Hey everybody, how are you today? So I'm back again with another episode of BioNexus Health podcast series. We'll be discussing Lyme disease, mold exposure, biotoxin illness, chronic sinus issues, chronic inflammatory response syndrome in today's podcast. Today, my guest today is Tariq Al-Hadidi. He is formerly a New Yorker, currently residing in New Jersey with his family. And he has made remarkable strides in his recovery from chronic illness using only natural herbal medicine. So I would like to welcome Tariq to today's show. But before that, I will request you and remind you to please subscribe to the BioNexus channel. All right, great. So let's proceed and welcome Tariq, shall we?
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
So Tariq, welcome to today's podcast. It's being recorded, it's not live,
Okay.
So, right, that seems to, set some people at ease when I say that it's not, live.
Okay. Fine by me. Either way.
Good. Awesome. So I'm so glad you're here, for taking the time.
Glad to be here.
So let's just begin at the beginning, shall we? What made you think about BioNexus Health? And, even more than that, what made you think about looking at herbal medicine?
Okay. So my story began years ago when I felt some discomfort, and it was unexplained when I went from physician to physician because my blood tests appeared to be normal. My doctors would send me on my way saying there was nothing wrong with me when I clearly knew there was plenty of symptoms that I was suffering from. And they really couldn't zero in on what it was. And one of them diagnosed it with candida, some kind of candida infection. So I thought that I would focus my efforts on finding a cure for candida. And I did find a very competent physician for that. And he did help. He did not understand the root of the problem, though. And I think what changed things is he asked me to do a nose swab for something new, some new test that came out. And that was the macrons. Is that the macron test?
Oh, the marcons.
Marcons, yeah. I always confuse marcons and macrons.
No,
So it was a marcon test.
yeah, no, it's easily confused. It's multiple antibiotic resistant coagulase negative staph.
Yes, I was
Marcon.
having sinus issues that even the top-notch sinus doctors could not figure out what it was. And they gave me, one nose spray to the next. Nothing was helping. As a matter of fact, it was getting worse. It was unexplained. I couldn't understand what it was, but he did tell me to take the test. I took the test, found out that it was positive, and I began asking him questions about that. He said, this is something new that just came out.
Mm-hmm.
So I started looking into it. And from that, I learned about the biotoxin pathway. Once I saw the biotoxin pathway, to me, that was exactly a blueprint of every problem and symptom that I had, which was coded to a level of detail that was unimaginable. I couldn't believe that I finally found something that reflects everything and every symptom that I had to the smallest, most critical detail. And once I saw that, I knew I had to get help in that area. I knew that was a direction I had to go. So I excused myself from my physician that was treating me because he didn't understand anything about it. And I did look into that particular field of medicine and found your product, which was the Formula 1 NSP. And I figured, okay, well, let me try that because nothing else has worked in the last, I don't know how many years. And then I connected with you, and knowing at that point that obviously this was a symptom of a much more serious, deep-rooted issue that I had to address. But at least there was a lifeline. At least there was something that I could look into that can address these symptoms where nobody else did. And I think my biggest shock to this day is how little our physicians know about these types of illnesses and what little help they offer. And I don't knock them down. I really don't. I just, to me, I'm dumbfounded how there's so little of this medicine that is even known. I mean, I wouldn't even have somebody refer me to this. It's like if they didn't even have a clue that this was going on. And then I connected with you. I took the tests, and the tests that you prescribed were the ones that actually were scientific in value and proved that I had numbers that needed to be addressed in certain areas. So it wasn't guesswork. The other help that I got was purely guesswork based on my symptoms. So,
Wait, so I'm sorry, Tarek, sorry. So I just want to clarify a couple things, for those watching. You actually mentioned that you had a lot of symptoms other than severe chronic sinus issues.
Oh, yes, absolutely.
So can you describe some of those symptoms?
If I could tell you what chronic fatigue felt like, it would be difficult for you to imagine that I was actually a functioning human being. When I say chronic fatigue, it was debilitating fatigue. I would have problems sending an email sometimes. That's how difficult it was. I don't know how I actually was very productive over the years.
Over the years,
in my work life.
Okay, and you're a husband, you're a dad of
yes,
three. You have
three
have
children.
many businesses.
Yes, and I,
Wow.
I actually, I work very hard, but when my work was done, I completely shut off. Completely shut off. No energy for social life, no energy for family life, disengaged, just tired all the time. Tired, fatigued, brain fog, and irritability. And but the fatigue was debilitating. It was like I couldn't understand what it was. It was a diet. Was it? I tried pretty much everything, and it was unexplained. I couldn't get to the root cause of it. Digestive issues, food allergies, and just an unwillingness to have fun, enjoy life. Quality of life was very poor. And I was just trying to, struggling to find answers. My health became my priority. I really couldn't venture into doing anything new. And I think the stress level that was added on was not knowing what the issue was. And to me, when I found out that there are answers, that alone got my stress level lowered quite a bit. Because at least knowing that you are in the right direction and that you have steps to take, and that this condition is no longer a mystery. This condition does have a name. It does have science behind it. It could be measured. It could be improved. It could be monitored. It could be tweaked. That alone gave me quite a bit of hope. And I can tell your viewers out there that, part of the problem of being in this condition is the negativity that's attached to your mental state. And I listened to some of your podcasts, and they said very clearly that a lot of your patients actually show up to you after they've failed many other types of treatments.
Yes,
and I'm definitely one of your typical patients. So.
Yes, that's correct. I was going to ask you that. So you actually found Formula 1 NSB marcons nasal spray. And
yes.
through research of the nasal spray, you found me. That's
yes.
Very cool. Okay.
Yes, and I read your story. I followed it. Very inspiring that you actually had family members who had, this type of illness, and you were able to create this fascinating program to help your family and help other people, to me, that's truly inspirational. It really, really is.
Thank you.
And as I was saying earlier, part of the problem your viewers may be facing is what I felt. After you go through time and time again programs that cost money, take time, and yield very low results, if no results, you start to believe that you can never get better, and you start to give up. And I think, excuse me, the first step is being able to rise above that level of thinking and know that you can improve, you can change. People listening might think, well, okay, that's a good thing that, there is a cure, there's a good thing that people are getting better, but I don't think it's going to work for me. And I was one of those people. But to me, I made a decision to rise above that. To me, I made a decision to understand that I'm going to cut my losses, I'm going to move forward. There's something there that I can identify with. I read it myself. I did the research myself. And what I saw was somebody talking to me, said, this is what you have. And every symptom was spot on accurate. My jaw dropped when I read it. I couldn't believe that it was to that level of detail, because it not only described it, but it described how it started, how it progressed, and what it became. And in that sequence is exactly what happened, what I experienced. So to me, I didn't need to be directed. To me, I was making a phone call, say, I'm ready to show up next Monday. It was a Friday.
Oh, you were?
I want an
Okay.
appointment. I want to start now.
Yes,
Nobody had to
yes.
sit there and tell me, well, what do you think of this? No, I read it myself, and that was, I was like, I got to get in there quickly. And then I found out, well, unfortunately, Dr. Dashore has a very long, busy schedule, and you're going to have to wait it out. So,
How many?
but
I
that was
know.
okay.
I'm so sorry. I know that's the thing. I think when you sent in a new patient request, I think it was a 4 to 5 month waiting list is what I had back then. It's up to 6 months. Unfortunately, I try and work like 6-7 days a week, and trying to reduce that. Actually, Tarek, I just wanted to make sure that you're okay. I know you're still recovering from COVID.
Yes, I had COVID a couple of weeks ago. I have recovered. I was actually working at home during COVID, so I didn't really have any severe symptoms. I do have a little bit of an occasional cough, but nothing serious. I'm totally functional. I'm totally okay.
Good. Yeah. I mean, you're on so many different herbals that, I wouldn't expect anything else. I remember, when we last spoke, you were a bit concerned, and I tried to put your mind at rest that, rest assured, with all the precautions that you've taken, and with you being on so many antimicrobial herbals, right, including antivirals, you'll be just fine overall. Recovery will be okay.
Yeah, and I worked through my whole illness, so I worked at home. So it wasn't like bedridden or anything. I mean, what else can you do when you're quarantined?
Right.
There's not really much going on television, so I had to work.
Yes,
so it wasn't really, it wasn't so bad. Yeah, I have a lot of confidence in your program, doctor. I really say that from the heart. I've never done a podcast before. I've never, attested to anything to that level in the past. I'm so happy that you're there saving lives. I really am.
Thank you.
I'm so happy that you're there enlightening people. I wish there was more of you. I wish this medicine was more available. I wish we would be able to catch this sort of thing earlier. The one thing I will tell people is don't think twice. This is your health. This is your life. This is the quality of your life. Don't look back, years from now and say, I could have changed the trajectory of my health had I acted sooner. I'm just, less fortunate that I found you later than sooner. I hope your viewers find you sooner than later. And I really do believe in the protocol that you put out there and the way that you do it in a fashion that doesn't really shock the system. It eases it into recovery, because doing too much too quickly can harm the body more than help it. So you clearly understand that, you clearly care, and your medicine works. I mean, your Formula One NSB is the only thing that I've tried, and God knows what I put in my nostrils over the years. I mean, I tried everything from the top-notch Manuka honey, the most expensive Manuka honey you can buy, right? They said, oh, that works, the only thing that works, that just made me sneeze a lot. But you were very confident. You said, this is going to do fine for you. And I'm thinking to myself, I from your lips to God's ears, because I just about tried everything else and nothing worked. And, for the first time in years, I can actually breathe easy. You get all the credits for that.
Thank you.
It's
Thank you.
it's a big change from a year ago.
Yes. I had, as you know, all of my formulations stem from me trying to help my son.
I listened to your story before I actually contacted you, and it was extremely inspiring. That it's amazing how, when we have to do something, particularly for our loved ones, our creativity and ingenuity rise up to levels that we couldn't even imagine. And I could really relate to that. It's kind of like when you care about something so much, you find yourself creating at a level and innovating at a level that you couldn't even dream was possible. And the fact that you were able to create this makes this whole ordeal a blessing in disguise. You're able to help so many people. I just hope. I still wonder to this day why this medicine is not as prevalent as it should be. It's a real science. This is not guesswork.
Oh,
this is not
absolutely.
guesswork. I mean,
Yes.
this is a real science. I mean, the tests speak for themselves. You can see, from the numbers, what is going on with your body. You can tell the story. This isn't, well, what do you feel? Let's try this. This is what I think you have. No. You go strictly by science. You go strictly by testing. You go strictly by what the science says, and what you see and what you read and what the test says is based upon what the next step is. And it's important to understand that, because if this method isn't being used, good luck to you, because it's going to be guesswork. It's going to be guesswork. It's all it's going to be, and we don't need guesswork. We need like real answers, and we need measurable results, things that you can quantify in numbers and measure and say, okay, this is what we need to handle these test results. And I saw some of these test results. They were very startling.
For your test, right? Yeah, the reports when they came back. Yes. Some of your results were pretty severe. That's true. Yeah. Now, you are a New Yorker, and living in New Jersey, and we know that the tri-state area has some of the world's most renowned, best trained practitioners, and you have seen many prior, right? Conventional medicine. That's exactly what happened to us as well. All very well-meaning, with their heart in the right place, tried their best to help. It wasn't just my son. I've lived through it myself, as you know, with the Lyme and the mold exposure and what have you. Ultimately, it was my herbal medicine mentor, that I ended up training with and did my doctorate with as well. With meaning, in herbal medicine and quantum physics. That is what kind of, like you said, from my mouth to God's ears. It was almost like divine intervention, coming into play. That's so it's been a huge blessing to be able to heal my family, heal many other families around the world, and to kind of shine the light a little bit on herbal medicine. It's ancient medicine, and it is completely scientific. And I'm glad many people like yourself, and I must tell you that the tide is changing. You know, many people are approaching, especially after the pandemic. Many people are looking at natural medicine as a viable option to strong, often toxic pharmaceuticals, you know, that people with chronic illness have tried. And they, you know, after years, they simply cannot tolerate the side effects anymore. That brings me to the question, can you talk a little bit about the improvements you've seen once you started on herbal protocols?
Yes, well, in the beginning, it was more of like a flatline improvement where I saw very, very minor improvements. I could sense something was happening. As far as my my sinuses were concerned, that to me was a little bit faster. So I started seeing improvements very quickly. But as far as my energy level, that I had a few ups and downs. But when you're persistent, you get to an inflection point where suddenly the improvement starts to increase rapidly. So it's not a steady straight line curve that most people expect. You have to be a little patient. You did tell me that. You have to be a little patient. You have to be very consistent. And again, the most important thing is to rise above the mindset that it hasn't worked in the past, nothing works anymore, I'm going to ditch this because there's another failed strategy. You have to understand that, you know, there is a science behind it. And I would like to add with neuropathic medicine, I have been an advocate of both neuropathic medicine and my regular medicine. I do actually, I'm okay with both medicines. I'm more into neuropathic medicine than anything else, because to me, when I go to my doctor and he can't explain what my condition is, neuropathic medicine can't. We can cure it.
I'm sorry. When you say you actually mean naturopathic medicine.
Naturopathic medicine, yes.
So, okay.
So,
well, no, because you're right. You know, naturopathic medicine can be neuropathic as well, because many people with biotoxin illness have tons of neurological issues.
Okay. Yes, I meant naturopathy. So it's the difference with your naturopathic medicine, and I've tried others in the past, is yours is the only one that actually takes blood work, tests the blood, comes up with a diagnosis, and has an application for that. The other naturopathic medicines do not. They go by other testing, and I've had other naturopathic medicine, like with the Candida treatment, but that was not really based on blood work. That was based on other tests. Yours was very, very extensive testing. You see what the issue is, and you know how to resolve it. So it's naturopathic medicine, as close to an exact science as you can get. Nothing is an exact science, but this is as close as they come. And that's important to understand, because you can rest easy at least knowing what's wrong with you. You can rest easy knowing at least that, you know, there is a way to turn this around. So that's the beauty of it. I think it doesn't get very popular because people try to, or maybe other types of medicine try to categorize it as not very scientific or not very accurate or whatever, but yours is very accurate because yours is actually measurable.
Well, I'm glad to hear that. I'm glad to hear that. You know, Tarek, we did lots of other testing for you other than blood work, right? We did other parameters, other body fluids. We did nasal swabs, teeth swabs, right? We had to look at genetics, because customizing the protocol to you, that is the key.
Yes, and everybody is different, and there's a lot going on, and the key is not only to understand what the diagnosis is, but knowing who you're dealing with and how that treatment is going to differ from the next person. So it's not like, well, here's a pill that I use for everybody, try it and best of luck. I'll catch up with you later. It's like, okay, this is who you are. This is how your genetics work. And this is what we found. And this is what you take. And this is the right dosage that you take. And then continue that for a while. And then we'll check up on you. And every time you did, I've been better. I mean,
Yes,
I've seen improvements. I've seen incredible surge in energy, incredible surge in vitality. Breathing has become so much easier. I mean, 1 year ago, I couldn't breathe easy. I really couldn't. And it's not like, it wasn't a lung issue at all. My lungs are just fine. But it was a sinus issue. And when I tell you I tried everything, doctor, I tried everything. And the most sophisticated cures from the most sophisticated, brightest doctors in the tri-state area. And with all the best intentions, they didn't have a clue what the root problem was. Not a clue. I till this day, I don't really understand why this medicine is not so prevalent out there, that it's not well understood. It's still a mystery to me, but I'm glad that there's more exposure to this now, and the more people know about it, the better off they will be. And I think they can be comfortable knowing that this, again, I keep repeating this, but this is a science.
Yes.
This is based on certain test results. C4A was one of them, that measures your immunity to, or how hard your body's working to fend off certain toxins. That's night and day. I mean, you can see it right there in front of you. You know what it is. You don't get tested that with your local physician. He doesn't. I've been getting routine physicals for years. None of that ever came up.
That is so true, because some of these newer things, right, for children as well as for adults, and it's not that new, mold biotoxin illness, chronic inflammatory response syndrome has been in the mainstream, not really mainstream, but has been researched and sort of available for 10 years, more than 10 years now. Lyme disease, additional co-infections that, there could be deeper reasons, the root cause of various symptoms that are deemed as, sinusitis, that are deemed as gut issues, Crohn's, colitis, diverticulitis, IBS. There could be something behind that clinical symptomatic presentation. And I absolutely agree with you that, I wonder why it is not more mainstream. It has been around long enough, especially for children, things like PANDAS, that is becoming more mainstream. Lyme disease and other vector-borne, tick-borne infections are becoming a little bit more mainstream. But, it's just, I guess there isn't a whole lot of profits in naturopathic medicine. So ultimately it may boil down to that. And additionally, I know that medical textbooks are only recently being updated, because a couple of my colleagues and I have myself written a naturopathic medicine case study for a medical textbook that was recently updated. I think that was, when did I do that project? That was last year. So hopefully, medical students of the future, I hope it gets included in my son's curriculum as well in med school. He's in med school now. But, it would be great if we had practitioners, doctors graduating, with a good, solid understanding of the root causes, as well as naturopathic options for the same, versus just learning, pharmaceuticals for symptom suppression. Sorry, go ahead.
Yeah, I mean, it's even the naturopathic doctors that I went to, to treat some of the symptoms that I had. We're not even aware of the technology that you offer. They were not even aware of that.
I see.
They were not even close to even suspecting that
Even
this was
suspecting. Well,
even
you know
suspected.
what? Oh, okay.
I was not referred to you by another physician. I was referred to you based on my own research.
Self-study, right? Yeah. Well,
Because of tests that I had. So I had a test.
Right.
I had the swab test. So the swab test came from the field of medicine that you practice. This was something that my prior physician admitted was new. And when I got that test, I started looking into it because I never, heard of this before. And then this is how I came across the biotoxin pathway. And this is how I identified the symptoms. So
Right.
we weren't even close to, getting referred to anyone, and that's the scariest part, because there are a lot of folks out there that are talking to some good physicians that don't even have a clue that this could be a problem going on. And you're like a detective. You kind of figured out exactly what it was. It was as clear as day and night. I mean, it was indisputable. I mean, exactly the symptoms that you discussed and everything. And when I spoke to you, you sounded like you've done this so many times before, and you have, and you kind of like understood. And I didn't have to sit there and explain myself over and over again, like what I was going through and what it is. And you kind of knew it from the get-go. I think you have a way after a while of kind of like looking at somebody and figuring out
The algorithm,
who you're dealing with.
right? That's at work. Yeah. It's just, thousands, right? Thousands and thousands around the world in so many countries. It's like I said, it's been a blessing. It's been a privilege because Tariq, nothing really hits home until it hits your home. It hit my home very severely. Thankfully, that's behind us. And, with you, when it hit you, when I first met you, you were a very different person than what I see, sitting in front of me today. There is gone is the apprehension, the brain fog, the anxiety, the gut issues, the sleep issues, of course, your breathing and sinus issues, right? Again, there was nothing wrong with your lungs. It was all marcons. Something would have been wrong with your lungs, in a couple of years if we hadn't addressed the marcons for you, because that's how the science works. But, we did not allow that backflow or, the downflow to happen for the infections to travel anywhere else. And here we are today. You recovered really well from COVID without any major, pharmaceutical intervention.
Yes, no pharmaceutical intervention. I really wasn't too worried about it, other than, boy, I have to take time off of work, and that's gonna really hurt when I get back. I have a lot of catching up to do and things I have to fix. That was my major anxiety, not COVID itself. But yeah, and I mean, that's behind me now. That's not even an issue.
Awesome.
I'm looking forward to a full recovery, or at least as close as possible to a full recovery, which I'm optimistic, I'm on the right path. I'm so glad that, I found your medicine. I'm so glad that you're out there promoting it. And it's amazing how, something personal that happened in your life can turn around and benefit many, many, many other people. I mean, you have changed the trajectory of my life, and I'm very grateful.
Well, that leaves me speechless. So I think I will respect what you just said, that touched my heart profoundly. So thank you for saying that.
Thank you, Doctor.
Thank you again for being here.
My pleasure.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit BioNexusHealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.